All right, all right. Welcome everyone. Welcome everyone. Tal Pie, brothers, you're on my mind, all stressed out. Welcome. So today's session is part of an initiative that our boss, Grand Bosler's brother Marion decided. He's a mental health professional. So he created this initiative where Omega Psi Phi, the National Institute on Minority Health and Health Disparities, come together to start a discussion for us to talk about mental health. So that's what we're going to do today. Today is our first session. Hopefully, we'll have many more. So what are our goals today? Our first goal is to educate us, Omega men, our families, and our communities on the effects of depression, stress, other mental health issues. The other goal is to communicate the importance of seeking mental health problems, and to encourage people who are affected to start to get information, to talk with their healthcare providers. You can start with talking with your internist. And ultimately, if you need treatment, to obtain treatment. In general, we want to normalize mental health issues and talking about it. So today we have a friend of Omega. We have brought to my attention by Brother Mike Curry. We have Dr. Kathy Scott Grinnell. She is currently the Behavioral Health Medical Director at United Healthcare. She is a native Houstonian with a double board certification in adult psychiatry and child adolescent psychiatry. She has served her community as a mental health provider since 1994. She has worked in private practice and as a professor before joining United Healthcare in 2011. Dr. Scott Grinnell enjoys reading and writing, and she published her first self-help book, which is entitled The Economics of Parenting, in May of 2019. As you can see, here's a screenshot of the book. The book can be purchased at Amazon, and she'll probably tell you later other your other favorite bookstores. And I'll have her explain what this slide means. I won't steal her thunder. So we'll first have Dr. Scott Grinnell come forward and give some remarks. So Dr. Scott Grinnell, please take it away.
Okay, thank you so much for having me, and kudos to my brothers of Omega Psi Phi for joining with the NIH on such an important initiative. And I'll just real quickly go back to that slide. That slide is a mnemonic that I included in my book on parenting, but it serves for all of us because, first of all, did you know that stressed spelled backwards was desserts? And so quite often when we are stressed out, we go straight for the sweets. So this mnemonic, it's all about, first of all, helping you to know when you're stressed and helping you to know when that stress has transitioned to a more serious condition, such as anxiety or depression. And those are just symptoms that a person who is depressed or stressed or under anxiety may note. Um, I can real quickly, I'm not sure how much time I have here, but basically,
You
sleep.
have all the time you want.
Okay, okay.
Yeah.
So basically, issues with your sleep, whether it's not sleeping enough or sleeping too much or having nightmares, problems with your thoughts, trouble concentrating, sometimes uh, formulating your words to speak, forgetfulness, um, those type of things. And then you can also have your thoughts get as um, as depression progresses, your thoughts can get worse and worse to the point of having thoughts of suicide or having hearing voices, for example. That's really severe depression when you start to hear voices that are either putting you down or commanding you to do things to harm yourself or harm others. So thoughts are really a big sign. If you start noticing yourself thinking differently, there may be something going on. And I have ranting there, which means irritability or argumentative, and you're not getting along with anybody. You're noticing you're having conflicts everywhere. Energy level, your energy level can be low. You feel fatigued, don't want to get out of bed, laying on the couch all weekend long, for example. Um, Sadness, we all know what that is. And for some people, sadness looks like sadness, but for some people, sadness looks like anger, or it may look like I'm not feeling well. I'm feeling sick. So sadness. We spoke about suicidality, which is very important. And I would just put a note here. If you're concerned about a brother, are you concerned about somebody? Don't be afraid to ask them if they're having thoughts of wanting to harm themselves or thoughts of wanting to, check out of here. A lot of people think if they ask that question, it may create the thought. No, it will not. That's a very important question. And when their answer is yes, or anything that sounds like a yes or resembles a yes, it is time for an emergency situation. You really do need to get that person to an emergency room right away. And lastly, we have the last two there is emptiness. Now nothing fulfills you. I used to love playing tennis, and now I'm not interested anymore. Or I used to love watching football or going to basketball games or whatever the case may be. But now I've lost all interest. I don't even want to go to my fraternity meeting. I'm just not feeling like seeing people, and I'm not fulfilled by any of the work that we've done or that I'm doing. And then that's the disconnected. I isolate myself and alienate. So with these symptoms, if you ever get to that the true diagnostic is 5 symptoms, but I tell people 4 because it's very easy to miss something yourself. So if you have 4 of these, it's time to seek out some professional help in the mental health arena. And then the desserts is just the opposite. So rather than running to carbs and chocolate and sweets, or there might be some other desserts that people use, but at any rate, we want to look at healthy desserts. So the first one there is doctor. Like I said, if you have 4 or more of those symptoms, you want to get to some type of mental health professional right away. Others that help is exercise. Your body, your brain releases certain hormones that are pleasurable when you exercise. And plus, it takes your mind sometimes off of whatever it is you're stressing about, gives you an opportunity to release and reset. So, exercise, spirituality. If you are spiritual, utilize your spirituality to help you come out of these episodes of depression. And I want to say this, I am by no means saying that if a person is clinically depressed, they can pull themselves up by their bootstrap and make it better. No, once it is a chemical depression, and you have 4 more of these symptoms, you really do need intervention and perhaps medication. Um, back to the good stuff. Someone find people who pour into you. All of us know people who take. That's draining. When you're in a low state or you're feeling stressed, you need to find the people that pour love into you, that pour into you, and spend more time with them. Expand your horizons. Try something new. You know, decide to take up a new type of class or a new type of a sport or something different that you haven't done before, just to expand yourself. Uh, I say reach goals, but you got to set them first. So I'm a big component of setting goals. I do it annually. I might do it weekly. Whatever motivates you most. Set goals and then celebrate what you reach. The ones you don't reach, okay, put them on to try next time, but celebrate what you're able to accomplish. And okay, I got to try something new there again. So start fresh. Okay, this is so important because we all have baggage that we carry throughout our life. Um, and some of the stuff from the past we've been carrying forever. And sometimes we just have to forgive ourselves, forgive others, so that we can really start fresh in each day. We really, I'm sorry, I'm a spiritual person. God gives us new mercies every day. So we really should give that to ourselves. New mercies every day, start fresh, ready to tackle your day. Thank you.
Good. So thank you, Dr. Scott Grinnell, for those words of wisdom. I'm going to open it up for questions. I have questions that people have already sent me. We had an email that went out to the fraternity, and I got back a few questions, and I have a few, just basic questions of my own. Um, People that are here in the webinar, please feel free to use the chat function. We're going to have Brother Ash look at the chat room and scout a chat room, and we'll take your questions as we see them. But for most of us, and again, this is Omega Psi Phi Fraternity Incorporated event, but all are welcome. All are welcome to ask questions. This is for everyone. We want to help all our community, all our loved ones. So the first question is, like I was getting ready to say, most of us are somewhat new to this. We're trying to normalize getting help for mental health. Doctor, can you tell us, what does the process look like to see a psychiatrist? Is it any different than going to see my internist?
That's a very good question. And I must tell you that we are in a deficit in the United States, almost the world, for mental health providers. So a lot of it depends on your insurance. Some people's insurance, they have PPOs where they have they have products where they have to go through their primary care doctor to get to a psychiatrist.
Mhm.
So that might be the case for your insurance, where you have to go see your primary care doctor, let them know you're depressed, and tell them you want to see a psychiatrist, and they will make referrals that way. I often do this for people. People are looking for psychiatrists or looking for a mental health provider, and they don't know how to find them. So I often tell them to start by getting a list from your insurance company. Who's in network for your insurance company? Let me look at that list, and then I can tell you, oh yes, this person is good. I know this person, da 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 da. So that's one way to do it. The other thing is, don't be shy when you call your insurance company. If you want a African American male as your provider, say that. If you're comfortable with a woman, say that. Whomever you are specific or feel like you will be more comfortable with, make sure you share that. So you get this list, you run it by perhaps somebody who's in the mental health profession, and then you're going to call for an appointment. And I will tell you that appointments, unfortunately, are the waiting list is high. So
Yes.
what I suggest is if you know you have four more of those symptoms and you're depressed, you go see your PCP and you say to them, I'm depressed and I just really need some help. And talk to them about maybe starting something, an antidepressant. Um, they can start it low and that will give it time to start working while you try to get an appointment to get in to see a professional. Get a therapist because sometimes whatever we're depressed about, sometimes it's genetic and runs in our family and you know that's why we get depressed, but a lot of times it's situational. So it's either baggage we're carrying from the past or something major, a major transition has happened in our life, or it's just we've come to a certain time in our life. I know you all look at sometimes depression in the elderly versus depression in younger men, and I think two things that stands out with me, and I would say I have two young adult men, um, and nowadays I see that when our young adult men are coming out of college, a college degree doesn't mean the same thing that it meant, you know, 20, 30 years ago. And
Mhm.
so some of them are coming out and they are not finding employment. And boy, can that set them into this train of, you know, depression, depending on what their major was in school. So that's one time. But there's also a life cycle as a middle-aged man, a middle-aged person, let me say that, woman or man. When we get to our late 50s, early 60s, we really start reflecting back and looking at our life and looking at what we've accomplished. And this is normal human development. And at that time, if I find myself unsatisfied, I am at risk for depression during that transition. So, so I say that to say that, you know, this can happen for a lot of different reasons. And that's why not just seeing a prescriber to get medicine, but getting somebody in therapy to really talk through what's the source here? What's
Mhm.
causing it? So what that means is one, if I'm taking a pill, the pill will work that much better. But two, I'm resolving the issue and I don't have to ever come back here again because I've talked through it, I've worked through it, I've processed through it, and I've moved forward. So um, I want to just mention that there's several different mental health providers. So you have psychiatrists, of course, that's
Yeah.
the
Yeah.
MD. Then
Mhm.
you have psychologists, and psychologists they can do therapy. They also do testing. So doctors, medical doctors, do assessments to diagnose you. Psychologists do testing to diagnose you. Both of those can do therapy, but only in some states psychologists give medicine, but most states they opt out. They really don't do it. And doctors are the ones that prescribe medicine, right? The psychiatrists. We also have nurse practitioners, and those are prescribers as well, who can give um, medication. I know when I did have my practice, some people would feel funny about they come to the practice and they're if they see a I actually set mine up where I saw the patient first and then transferred to nurse practitioners. But because the shortage is so great now, that's different. Nurse practitioners are trained and they're supervised by docs, by psychiatrists, but they see patients independently initially themselves as well. So you can rest assured that there is some doctor working with them, but nurse practitioners are qualified to diagnose and prescribe medications. And they also do some therapy. Then you have social workers or um, LMSWs, which are licensed mental health, mm, LMS, licensed mental health social workers. I might be missing that,
That's
but
okay.
they're also licensed practice clinicians. These are people who are trained in therapy. And so you certainly can see them as well. But all of those are mental health providers. But guess what? Your primary care doctor is a mental health provider too. They don't have the expertise of
Mhm.
psychiatry, but we have now, because of the shortage, there are lines of communications for even your PCP to get consulted by. They have a psychiatrist available or a hotline available for them to call and consult with a psychiatrist to make sure they are moving in the right direction for their patients. But the goal is to get to the psychiatrist if that depression is a major depression. But I was just telling you all that because it may take 3 to 4 months, and you certainly don't want to sit waiting with depression for 3 to 4 months with nothing happening.
Mhm. So now that I'm in the office, I'm seeing either a psychologist, a psychiatrist, a therapist. We have a question in the chat. What would be a red flag to these mental health providers that I'm like, this is maybe not
No.
doing so well? Yeah. What would you
So
say?
that's very good. Okay, let me start with the therapist,
Mhm.
because it's really important for you to feel connected to your mental health provider, especially your therapist. You have to feel comfortable enough to be able to open up and share. And of course, every first visit is going to feel awkward. It's going to feel uncomfortable. Think about it. Anytime you're about to grow, you have to go through a process where you are outside of your comfort zone. So expect some um, discomfort. But if you're dealing with somebody that you can see right out, for example, that they're racist, and I don't mean to just throw that out, but it's so funny. I remember one time, my last name is Scott Gurnell.
Mhm.
So I had someone come to my office, a white male. He was coming, wanted some help with alcoholism.
Mhm.
And when he saw that I was a Black female, and he actually told me, I thought you were a white male. And, and I said,
Oh, he saw
okay,
Scott Grinnell.
Scott,
I got you.
yes, he missed
Right.
the Kathy, exactly. So, so at any rate, I knew that was not
Mhm.
what he was looking for. But what I said to him is, well, you have some options. You can leave, of course, now, or we can go through the assessment and
Mhm.
I can figure out what your need is, and then I can refer you, to one that you feel more comfortable with or whatever. So he did decide to do that, and as it turned out, he really did need chemical dependency treatment. I wouldn't handle that. I
Mhm.
might would handle detoxing him in a hospital, but I would not handle the counseling that comes with
Mhm.
substance abuse anyway. So I was
Mhm.
able to go through the process with him. But if you sense anything of that sort, and I'm gonna just say in this day and time, I mean, I'm
We're
ever
amongst
since
friends. We're amongst friends.
Yes, ever since George Floyd, I had to do some soul searching and look at myself and look at what I was. But about 10 years ago, I fired my PCP. And she
Mhm.
was a person of color. She was not African American, but she was an Asian lady. But after 20 years, I felt like, okay, you should know me by now. You know, I'm coming to see you on a regular basis. And I know we all have a lot of patience, but it gets to a point for a doctor, you might can relate to this, Dr. Bill, where
Uh-huh.
all you have to do is look at, one sentence in the chart and you know who you're dealing with if you've been seeing them for a long time, right?
Right,
You
right, right.
know that person. I mean, and so, and I wasn't getting that. So I literally changed my PCP because I wanted to be with somebody who knew me. I mean, when I
Mhm.
come back, I don't want to have to remind you that, I had this event 20 years ago or whatever. But at any rate, this is a day and time where everybody should be being intentional, and I mean everybody, and I mean that our fellow um, majority physicians should
Mhm.
they should be working hard to make sure you feel welcomed coming
Right,
into their practices and coming to see them. And so if you're not feeling
right.
that, that's something that may certainly turn you away. But yeah, comfort level is important, making sure that you have somebody who is hearing you.
Mhm.
There are some doctors that move so fast. Some people who move so fast in their practice see so many people that they're not
Mhm.
listening. And
Right.
so if you find yourself, because you know, what patients will do, they'll come to your office and they'll sit and talk to you. If they don't trust you, you give them a prescription and they take it home and they're not going to take it because
Right.
they don't trust you. And so if you're finding yourself doing that with your doctor, any type of doctor, that's a wasted relationship. You need to find a new one. You need to have somebody who y'all reciprocate the conversation, they're listening to you. You don't feel like you're having to repeat the same thing over and over and over and over. You know, at some point they should get it. So I think it's really important to be able to connect.
Right. So we mentioned medication. If you may ultimately have to take medication. What if I'm afraid to take medication? You know what I've heard, I've seen, it has some type of, side effects that I don't want. It may affect relationships with me and my lady. What do
Mhm.
you say about that?
So very true. There are, for example, some antidepressants that may affect you in that way, and there are also some high blood pressure medicines that affect men in
Mm,
that way. But
right.
if it affects you in that way, you need a new medicine. Bottom
Okay.
line, you don't
Right.
want to sacrifice one thing that may depress you for another,
Mhm,
right?
mhm.
So if you're having side effects like that, you definitely want to ask for something different, and they should hear you and change it. There's a lot of variety out there. But I do want to say that every medicine, from Tylenol to aspirin, every medicine has side effects. And people don't realize that. All medicines have side effects. And when they're doing studies, this is what's interesting. When they're doing studies to look at side effects, let's say, for example, they may have 1,000 people to take that medicine during a specific period of time to
Mhm.
see what the side effects are going to be. And whatever those individuals suffer with during that time period goes on the list as a side effect.
Right.
So, very simply, if somebody gets killed in a car wreck,
Mhm.
it's going to be on that side effect list.
Right.
It might be way down at the bottom,
Right.
but at the very top is going to be the most common things that people suffered with. So those are going to let you know, okay, these are the true side effects to these medicines. You get down here to flu and da da da, and it's 2 or 3 uh,
Mhm.
percent. You know, okay, that was just by chance. But every medication has side effects, but not every individual is will experience the same side effects. So you shouldn't be afraid. Depression is more deadly than most of the side effects. Um, if a person goes without depression, you run the risk of those thoughts turning to hallucinations. You run the risk of those thoughts turning into suicidal ideations. And as we all know, men, when they get to a point of suicide, they're a whole lot more successful at it than women. So we do not want it to go that far with the depression. Um, I will mention this. I am not by any means an alternative medicine person, but
Mhm.
there is some people will take St. John's wort for
Mhm.
mild depression. But
Mhm.
again, if it's major depression or if it's another type of mood disorder, that's not going to work. You really do need the medication because what happens when you're depressed or have mood disorders, your brain chemistry changes. So you need medications to get your brain chemistry back in line so that those symptoms can go away. So there are some instances where medication is definitely the answer.
Okay, great. So in short, don't be afraid to come to see the mental health professional just because of side effects. Not everyone is gonna get the side effects listed that you see on TV. So
Very true.
that's wonderful. We had a specific question about bipolar disorder. How do you know someone has it or you have it? And that was the question.
So it's going to be very hard for a non trained individual to diagnose a person as bipolar.
Hmm.
That the word has been thrown around quite a bit. It is real. And it can, I used to, that was my research focus when I was in academia. and bipolar disorder in children. Very rare in children, but it does occur. Usually it's in cases where they have parents or, they have a genetic loading for it. But this is what I would say a person, and there are grade, can I say grades to it? There's the true severe bipolar disorder, and these patients can look very sick. Um, um, you know, their hallucinations. What happens with bipolar, they call it that because there's two different poles of moods a person could have. And that could range from very high mood to a very low mood. The very low mood looks just like depression. So a lot of people may not get diagnosed with bipolar disorder for 10 years. And the reason why is because they only go to the doctor when they're depressed. So the doctor only sees them depressed. They don't get to see the
Mhm,
highs. They feel good in the highs. So they don't always come to a doctor
mhm,
unless it gets to the point of mania where it's so severe they're disrupting their life.
mhm.
So a very severe mania, the way that would look is a person will have hallucinations and delusions, and they will be what we call grandiose delusions. So these are people that um, they may think that they're millionaires and they'll start giving away all their money or start
Mm,
spending money like
mhm.
crazy. One time I had a
Right.
patient take a pass from the hospital, went and bought a brand new Porsche and had it sitting out in the front of the hospital, no parking zone, just sitting, so they can get manic and they'll spend money like crazy. They do
Mhm.
not need sleep. They can go
Right, right.
days without sleep and everything speeded up. They're talking fast, they're moving fast, so think about it. So that's when it's out of control. If you
Mhm.
have that and it's moderate, what it will look like is that I'm getting a lot done. You know,
Right.
I can get a lot of
Very productive.
yeah, a lot of projects done. I can get, I don't need to sleep. I can paint my whole house in one day. Some of them will clean excessively. They, will literally get a toothbrush and clean the whole house with a toothbrush. I mean,
Wow.
it still can be disruptive,
Uh-huh.
but sometimes it can look productive. And that's why there's a lot of literature about the genius of a bipolar patient because sometimes they can get in this zone where they can create and they
Right.
create things that become that can be really great. But at any rate, so there are what we call mood swings. And one of the things I know, like with children with
Mhm.
bipolar, their anger is their anger is off the chain. I mean, when
Mm,
they get angry,
mhm.
we've all seen children have temper tantrums. They
Right.
want some candy, they throw a temper tantrum. You might give in and give them the tantrum, or I mean, the candy, or you may
What they
have
want.
some, yeah, have some kind of behavioral approach where you can get them to stop.
Mhm.
Whereas a child who's bipolar, once they get going, they can't stop, and it's going to last hours till everybody's worn out. And so the moods are so dysregulated with people with bipolar that um, there's no cap off. It
Mm.
doesn't it doesn't stop. It can just go
Uh,
way overboard.
mm,
So as far as a person who might think that they are bipolar,
mhm.
um, what I would say is if you're having episodes where we talked about the depression part and what that kind of looked like, but where you're having episodes also where you can go days without sleeping, where your thoughts are racing, where you're getting into it with everybody, but you really also kind of feel like you're better than everybody, you know more than everybody. It can sort of kind of sound narcissistic, but it's
Yeah.
so complex. And that's why I
Yeah.
say it's hard for you to diagnose yourself. You certainly
Mhm.
can go see a mental health professional and have them to really look at that. There are different tools that doctors and psychologists can use, but it really does take the eye of a professional to really make that diagnosis.
Mhm. Good. You mentioned children, and I want to get both extremes. We just recently in our community had a 8-year-old commit suicide. Can you speak on social media, children? Um, a lot of us are afraid, our kids are gonna, do something to themselves. Can you speak a little bit about that?
Yeah, and I don't know about that situation, but I will tell you, I think the youngest child that I've ever known to complete suicide was a
Mhm.
6-year-old.
Wow.
And so uh, it is very true that depression is real and it's real for everybody. Uh,
Hmm.
children, when they, okay, social media. First of all, we all, I don't even know if I have to sing that story, but we all know that everybody put out their very best, the best of who they
Hmm.
are on social
Right.
media. And so if I'm comparing my life to somebody else's best, that certainly can make me feel like I've fallen short. And then with children, there's also the bullying on social media. If you could think about before social media was so hot, if a rumor gets started at your school, you got a circle of people that know about it and they're bothering you about it, but you can eventually get past that circle. But with social media, it could be everybody. And so that bullying can be so hurtful.
Hmm.
The thing that I would say to parents, of course, we need to be monitoring our children's use of social media, especially young children and teenagers, and teaching them, making sure that they're grounded with values and morals to understand where their worth comes from is so important. You and your relationship, your conversations, your time with your child will trump everything the world has to offer it. If you are giving them that, giving them the time they need, giving them the love they need, giving them the conversations. There are conversations we have to have with our children about all of this, all of these things, how to deal with a bully, how to advocate for themselves, how to raise their hand and say something to you when they need extra advocating. Those are things that are important to empower our children with so that they won't fall prey to some of this. But if your child all of a sudden is more angry than usual, if your child is isolating from the family more than usual, if your child is eating less than, if you notice in their grades are falling, they don't want to play on their, basketball team anymore, any of those changes happen, that's a red flag. It's a red flag that something is not right, something's going on with your child. And you can start off by trying to talk to them, but it may be that you need to get them to a mental health provider as well.
Okay, good. Um, we have a question from our boss list. Um, how does a person know when your therapy can stop? I think maybe after seeing a doctor, or also I guess probably medication. You hear stories of people saying, "Oh, I feel good. I don't need my medicine anymore."
Yeah, that is so classic. Especially that's classic for bipolar. When
Hmm.
they start feeling better, they stop their medicine, and but and that leads them down a path that really can make their symptoms worse and worse and worse. So you really don't want to go there. So what happens? Okay, two different things. One, if we're talking about genetic depression,
Hmm.
there's a family history. You've had more than one episode in your life. Let's say you've had 3 episodes in your life, then more than likely your psychiatrist is going to want you to stay on medicine,
Hmm.
and it's protective. But they will, once all your symptoms are have subsided. Typically depression lasts about 2 years, okay? But
Wow.
once your symptoms have subsided and gotten better, you and your psychiatrist can start lowering the dose.
Hmm.
And basically, I will see a patient and I'll just lower the dose every month until they don't need, they're off of it. If
Hmm.
they are somebody who has just a one-time situational depression, or they had one when they were 19 and now they're 40 and they have one, I will try to get them off the medicine. but I'm going to do it slow
Mhm.
because the medicine, once it builds up in your system, the changes take time because of the uh, this the metabolism because the way the medicine is metabolized. If
Mhm.
I make a change in a dose today, I'm not expecting to see the effects of that for 2 weeks or so. Okay.
Right. Right.
So I am going to slowly do it, and when I come back, I'm checking you for symptoms. If any symptoms increased, we're going to go back up. So the best way to get off is just slowly let the doctor decrease it until it's gone. And then when it's gone, if everything's good, it may take you, a month or so to adjust to that. But if you're adjusting and you're still functioning and you're still doing everything correctly, then we're good. Okay.
Mhm.
So that's sort of how you wean a person off medicine. For depression, for
Mhm.
bipolar, you you do not take a person off medicine. But let me
Right.
just explain something.
Uh-huh.
There's something called cyclothymia, which is mild, like a mild bipolar. So these
Mhm.
people have mood swings, but they don't have five symptoms of depression. They might just have two or three of depression. They don't have the severe mania, but they might have two or three symptoms of hypomania, which is a little bit of mania. Those patients don't necessarily have to be on medicine. They have to be educated of what's going on with their body. And some of them at periods of time might need medicine in their life. So that's complicated, but it is what it is. So that's how that works. Um, so with bipolar, we do not want to see patients come off. You want to get them to the minimal amount, the least amount of medicine needed to maintain their their symptoms. I think about a patient I had that she was a teacher, and she told me that when she gets manic, she gets sarcastic.
Mhm.
And so, I'd see her, periodically. Things went well for a very long time. And one time, I heard her coming to my office, coming down the hallway, just being sarcastic and blunt and nasty with people. And I was like, oops, today is the day.
Uh-huh.
I, you know,
Right.
but it's real important to learn what are my first symptoms. A lot of bipolar patients, their first symptom is not sleeping. They will notice they're not sleep. That's their symptom that their meds need to be adjusted. So it is something that can be controlled, and a person can, function and do have their careers and do everything they want to do if they stay on top of it and stay connected with their doctor and follow instructions and listen to their body.
Good, good. So back to the title, All Stressed Out. For those of us that, don't need to go see a therapist or doctor, stress, everyday stress, just being a black person in America, you're stressed. You got, microaggressions. You got people, you're a physician, and you come in the office and they're like, well, where's the doctor? Just little things like that. Or you have priorities, COVID, financial, losing your job. What are, the question is, mechanisms that we can use to manage everyday stress?
So one of the things I want to say, and I'm going to go, well, COVID, first of all,
Mm-hmm.
when COVID started, it literally, we know, shut the whole world down.
Right.
We were all shut down. We were all at home. We were, forced to be with loved ones, forced to face ourselves.
Mm-hmm.
Okay. So now we're not ripping and running and busying
Right.
and doing things. And now we get to see
Slow down.
ourselves.
Right.
Yeah, we slow down.
And whoever else is in the house.
That's right. So we see ourselves, they see us now, and
Right.
we see them, right?
Mm-hmm. Uh-huh.
So it was definitely a time for uh, um, uh, self reflection and a time for growth for
Uh-huh.
everybody.
Mm-hmm.
And then we turned around and had the George Floyd murder right
Right.
there.
Right.
So now, not only am I seeing myself um, for how I interact with my family and how I interact if I'm, with my coworkers, if I was fortunate enough to work during that time.
Mhm,
But now I get to see how I have interacted with this society
mhm,
and the racism that I grew up under.
mhm,
So hopefully for people, I know for me, that was a true disorienting um, experience.
yes.
And from that, I then had to really look at myself. So now I'm a baby boomer.
Mhm,
And I'm a baby boomer who did well. Okay.
mhm, yeah.
And so I looked at, okay, so I really fell in my place and became satisfied with who I was told I could be.
Mhm,
Okay. I really let down. I feel like Black Lives Matter was not just about being against, whites, but it was
mhm,
against baby boomers because you guys let us down. You made us think things were kind of all right and we could really excel and we didn't have to worry. Even though we did the talk with our children,
right.
I take responsibility for I still missed the mark. I missed the mark with my young people, and
Mhm,
they were not accepting what I had learned to accept.
mhm,
So now I'm looking at me. So I'm really going a different place, and you might not want me to go here, but this is my passion.
mhm,
Brother Kerry knows this is my passion. So I start looking at myself, and so what I said is I can't accept things the way they are anymore.
mhm,
I have to be different. I have to do things different and I have to expect difference. So if I'm going to be faced with a microaggression,
mhm,
I'm going to speak up. I'm going to call it to your attention. I'm going to
mhm,
give you an opportunity to see yourself. I'm going to really try to educate you and help you see yourself.
mhm,
So, because our blood pressures are high in African American communities, because we
mhm,
stuffed that stuff, we took that stuff.
mhm,
We let it happen and go home and we talk it out and fuss about it at home. But no, it's time out for that. It's time for me to stand. So a big shift, a big shift. So that's one of the places for self care for us. We have to advocate for ourselves. We have to advocate for our race. We have to advocate for a change.
mhm,
So that's very important. The other thing that we have to do to take care of ourselves is really look at our spirituality. Where are we?
right.
Are we feeding ourselves spiritually as well
Spiritual.
as taking care of our physical bodies by
Mhm,
exercising and eating right?
right.
Even the I'm sorry, the concept of food and what we have been told is food.
Yeah.
w- you know, we have to look at that. All of that stuff is breaking us down. It's breaking our minds down. And people
Mhm,
don't want to go see the mental health profession. But guess what? If you lose your mind,
mhm,
your body's not going to work.
right.
If you lose your mind, you can't do anything. So we really have to take more responsibility of taking care of our mental health so that we
Mhm,
can be the best we can be at everything. If I
right.
if I have a healthy mind, I can get a whole lot of things done, but I
Mhm,
do have to make it a priority.
yes. Yeah, and I agree. I think connecting with each other. We as human beings are social people. So I think COVID took that away from us. Virtual is cool, but I would have loved, although it would be a plane trip for you, but I would have loved to have this together. When the brothers started to have frat meetings together, the ones that I could make, the couple um, sessions we've had this past week have been very uplifting to me. You smile, you get your endorphins going, and you communicate. So we have to, as we know, friendship is essential to the soul.
Definitely.
So community, bros, I think exercise. Getting our exercise in, and you don't have to go out there and lift 500 pounds or run 4 miles or bike 50 miles. We can start by walking.
Mhm.
So maybe that's an initiative that that I can help, we all can help, just get out and maybe start walking. And you also mentioned the food. Um, bros we like to eat that fried chicken and the pork and whatnot, and drink and smoke. So these are things maybe we need to kind of reduce, use in moderation. So those are things that we can use to help cope with stress. Um, so I don't want you to leave us without telling us a little bit about your book, why you wrote your book, and if you could just do that.
Sure, sure. I am so I what I actually I love to write. I've been
Okay.
writing for years. I do have some things published on the academic side, but I'm now starting to write books, for the general population. So this book, I wrote this book first because I am a child psychiatrist.
Mhm.
I have three adult children, and I do, and this is spiritually based, and so I had a certain way that I reared my children, and I tried to do it the way the Bible teaches us to do it, and I think the results were awesome. And so I wanted to share that with others. So just to brag a little bit, okay, so I have an adopted son who is now doing very well. I mean, he's entrepreneur as well as he works over a school district. He takes care of operations for a school district,
Uh-huh.
and he's doing very well. I have my oldest son who just came out of the Air Force. He went to the Air Force Academy. He's a major in the Air Force. Well, he just
Wow.
came out of the Air Force. He's now at Northwestern
Uh-huh.
getting his master's MBA. So I can see that he's doing very well. Both
Mhm.
of them are married to lawyers, just so happen. I don't know.
Oh wow.
So,
Okay.
but then my
Not
daughter,
malpractice lawyers, I hope.
huh?
Not
No,
malpractice. Not suing us, are they?
no, no.
Okay, good.
No, one of them is actually a JAG, a major in the Air Force.
Wow. Okay.
The other one is she works in employment law, and she is
Okay.
doing
Good.
very well. And then my daughter is a captain in the Air Force. She also went to the Air Force Academy, and the Air
Mm.
Force Academy is one of those best kept secrets that our race don't know much about, but they get this free education. They come out as officers, but they get jobs that are like the cream of the crop jobs. All of them, their weekends are there.
Mhm.
It's just been a blessing. She just got her master's in operations research
Mhm.
as an analyst. So she's heavy in math. And then my baby boy is now in law school. And so my children did very well. So I wanted to share a few nuggets as to
Mhm.
how I reared my children and how it paid off. And I used God's system to do it. So that's what that book is all about.
Good. We have a brother that went to the Air Force Academy, brother Kerr, and yeah,
Awesome.
he's doing great things. So I just had a few slides that I had, and basically just wanted to normalize. So if these people, Michelle Obama, if she can talk openly about mental health issues, Serena Williams, The Rock, with all the money that he has, and our own President Obama. Basically, he's saying if you can go to the doctor, if you got a leg that needs fixing, you can go and get your head right and get your mental health. And again, that's nothing weak. That's about being strong. So one of the questions were for us, where can we get help locally? The National Alliance on Mental Illness. We have a chapter or branch in Howard County. Here's a phone number here, and I can send out through our fraternity blast these numbers. But there's a 410 number. That's not the crisis line. That's just a general information line. There's an email. Below that, you can see the crisis line number 410-531-6677. They offer mental health education. Um, they have support groups that individuals can go and belong to. This is their national number, the 1-800 number. You mentioned I'm a veteran. You mentioned you seems like you have a whole family full of either active duty or veterans. So what about our veterans? We know that they have a very stressful position, job. So where can veterans get help? There's a veteran crisis line. You can see here there's a 1-800 number at the top, 273-8255. It's 24/7. And again, everyone, mental health, just like that you have high blood pressure, all this information is confidential. It's, physician-patient confidentiality. They're not going to go out there and say, you're having this particular problem or whatever. So for our veterans, and then we also have a frat brother, Brother Xavier. He has a organization in Howard County called Uplift Empowerment. So his way of helping veterans deal with mental health is by exercise and good nutrition. So maybe at a later date we can have him talk. Here is his email information at Empowerment, Uplift and Empowerment. It's right there off of it's in the Village Center. There's a phone number here, 240-575-5383. So as we know in our fraternity, what we have 4 cardinal principles: manhood, scholarship, perseverance, and uplift. So what I was thinking while I was doing this, what can the fraternity, what can we learn from this? Manhood. So I think in a way, sometimes we have kind of gotten away from what I think the founders maybe thought about manhood. I think we're on the surface, we're thinking being strong and, just kind of being out. But like President Obama said, manhood means, if you're hurt, if you have mental issues, you're not weak if you get help. You're not weak if you ask a brother for help. That's not being weak. That's being a man. Take care of yourself so you can take care of your family. What about scholarship? Don't get your information from, a brother asked me, hey, somebody told me to do this at the barbershop. I said, what, the barbershop? Yeah, they told me I don't need to get a colonoscopy. I can just do this, I can just do that. No, get scholarship means someone that has an education, someone that has some degrees behind their name. So that's my take on the scholarship. The perseverance part. There are barriers to seeing physicians. One, we know when you see physicians, you have to actually talk to them. They have to actually listen. We mentioned that. But as we know, it tends to be African Americans. We receive less accurate mental health diagnoses because I think some of it could be cultural. If you're not talking to a physician or someone from your culture, they might not understand what you're talking about. We receive less treatment from our counterparts. I don't know if that's due to socioeconomic, cultural, or insurance issues. As we all know, and I was reading a book called I think Medical Apartheid. So we have cultural mistrust, and it goes beyond. The first thing we want to talk about is Tuskegee, but it goes beyond that. Before, how they experimented on us, surgeries and women, and even currently how they, how they released disease-ridden mosquitoes into African American communities, how they, did put radiation and things of that nature. So we have a genuine distrust to healthcare professionals. And then you add, the mental health aspect on it. I understand, but physicians are supposed to help us. So, there are studies out there that show that patients generally do better with people of common ancestry. So we need to search out and look for African American physicians, therapists. But the problem with that is, Dr. Scott Grinnell, as you mentioned, African Americans in medicine are, like 3% of the physicians, and mainly in my class, maybe 2 or 3 people went into psychiatry. So I don't know how many from your class went into psychiatry, if you can remember.
We actually had a large group
You
to
did? Oh,
go
good.
into. We had about 12 out of 200 that went into psychiatry.
Uh-huh.
But the other thing to talk about right here is how the young people going into medicine is decreasing drastically,
Yeah.
and the number of Black males
Oh, yeah.
has it has decreased back to numbers equivalent to in the 70s. So we're
Yep.
really, really losing ground in that arena.
Right. So, so we have ways to go. Are there any more questions, or any last thoughts, Doctor?
I will just say, and I appreciate you all doing this. I appreciate you all having me today. This is a great work, very important, and I think it's just it's a time where we all have to pay attention to our mental health, and we have to do what we need to do to stay mentally healthy, so we can stay physically healthy.
Great, great, great. All right, we are running over. Thank you so much. And everyone, thank you for joining us. Have a good day.
Bye bye.
Bye bye. Thank you so much.